go back to the beginning of this whole COVID. Yesterday the president spoke, and I listened to whatever his uh, directives. The issue is, how do you enforce this directive? Are we going to tie the people? What about those who don't want the vaccine? As a public health official, I actually believe that the vaccines are good, and everybody who has to be vaccinated should be vaccinated or should get the vaccine. Is, as usual, that what the current government does is confuse the system and then brings out another directive to add to the old confusion that we already had. Remember that the COVID came. There are policies. They, the, the president comes and gives a speech or an address to the nation and brings all kinds of policies. Then he leaves it for implementation. The issue starts when there is lack of proper implementation of his policies. So his policies so far, or his directives, have been what I call schizophrenic. It's very confusing, and we don't even know what the mandate is. COVID came, there was no vaccine, so everybody was scared. Finally, the European countries and America and other Western world decided to quickly come up with a vaccine. The vaccine came, we were all excited because that is really, there's no treatment for COVID. Whichever variant you have, there's no treatment. The only thing we can do is our body's immune system with immunization. So what immunization does is, if you immunize the person, your body's immune system now will fight a second COVID when it comes. And that is why we have been immunizing children, and now we are immunizing adults. So with COVID, so the issue is immunization was the solution to the problem. Was the solution to the problem. The health minister, remember this health minister issue and this the Arabs who brought some vaccines into the system. As we speak today, the immunization schedule was going on. The public education that was supposed to be really done in resourcing NCCE, resourcing local governments, resourcing people in the media to really put out massive, aggressive public education. The resources never got there for that job to be done. That's the first thing. So the public education was lacking. Then the health minister went to these Arabs and brought in some vaccines into the country that came to contaminate whatever we had. Whether the vaccines were genuine or they were fake, up to today, we don't know. He has not been held accountable. Nobody has come to reassure the public. So the message was out there. They started, and then they came to confuse the system. The very people in charge of our public health. Remember, this COVID thing is not only a public health issue, it's also a national security issue. The very people we have entrusted our public health to are the same people who came to contaminate the system. No accountability, no explanation, nothing. And today, the public now believes that maybe the vaccines are not genuine. And that is what we heard from the Volta region. The people are saying in the Volta region that you're going to give us this vaccine, you're going to change our minds on where we have to vote. You see where the matter has gone. He has contaminated the system. Now, all of a sudden, they have brought a new directive that mandatory you get to the airport and you have to be vaccinated if you are not vaccinated. How are you going to enforce that? Are you going to tie the people to a tree or a hospital bed? How do you even enforce this thing? What if I come and I say that I have a medical condition, and because of my medical condition, I can't take the vaccine? What will you do? Force me? They are not even sure what their policies are, and they're not even sure how to implement it. And they themselves are contaminating the system. They have made this thing political. Up to today, the PPEs that they ordered with all the monies that we have gotten for COVID, some of the health facilities still don't even have appropriate PPEs. basic thing as PPE. The public education didn't go. The massive public education they should have done to educate the people that this COVID is a worldwide pandemic. It's a serious problem. Thank God we haven't gotten the numbers that the Europeans and the Americans and other Western countries are getting. But it is a public health issue, serious public health issue, for which we don't even have the health infrastructure. They didn't do all that. Then they themselves came to contaminate the system with this Arab people. How many vaccines did they bring? Were they fake? Were they proper? How did we get it? Is it just water? Is this the one that is all that stuff? The Minister of Health is still at post. He hasn't complained to Ghanaians. He didn't reassure the public. Fast forward several months later, there's a new variant, and now they are telling us that by force we are going to vaccinate you. They have closed the land borders and opened the airport. Why? What's the difference? They are all entry points. So whatever you are doing at the airport, why can't you do the same thing at the land border? Ghanaians are suffering. It's holiday season. The traders who are trading at the borders, you know that our border towns are huge trading posts. They can't go back and forth. So if you don't have money as a Ghanaian, a legitimate Ghanaian, to buy a ticket to travel by plane, you can't come to the country. I mean, the policies are so disjointed and so schizophrenic. I don't even understand what the real policy is. Every day I shake my head and I try to understand. So what is the policy? Somebody coming to the airport is different from somebody coming through land border. People trading through the airport, they can trade, but people trading through land border, they can't trade. What exactly is the policy? And how do they even want to enforce this policy of mandatory vaccination? Do they have the amount of vaccines needed? Number one. Number two, the people who are still insisting they don't want it, how are you going to force them? Are you going to jail them? The people in charge of our health system, our vaccination, have they even reassured the public that the vaccines in country are safe? When we were trying to tell the people that it was safe, go and get vaccinated, all that stuff, we did a lot of work. Then this health minister himself came to take us back. Now he turns around, or they turn around, and now they're bringing a new policy just as disjointed as the last one. Where is the public education? When was the last time you had massive, aggressive public education for people to go and take the vaccine? To reassure the public that the vaccine stock is good. As we speak today, you know that when you start vaccination, there's only one thing you are trying to achieve with your vaccination, right? And that is something we call herd immunity. H-E-R-D, herd, meaning a group, head of, what's the word? Head of animals of some sort. Immunity. That herd immunity means that we have to vaccinate at least 65 to 70% of our population before the vaccines will mean anything. Otherwise, you haven't done anything. I have been vaccinated. I've gotten both doses. I even traveled outside the country and got a booster dose. It means nothing if we don't reach that herd immunity, because that means that anybody who there's enough of us immunized in the country that anybody who has not been immunized or anybody who gets the vaccine, the virus cannot be transmitted amongst the group if 70% of the group is vaccinated or have gotten the disease by primarily getting the disease. Where are we today? We are 31 million people. 70% isn't about 21 million. Where are we today? Even the Ghana Health Service themselves, their projections, how far are they? They are not even near what they said they were going to do. They haven't accounted for public COVID funds. They are still borrowing for COVID and healthcare, which hasn't even been the first one. They haven't accounted. They are still adding more. They are contaminating the system with their own excuse my language, but sort of ineptitude. The people who are supposed to be held responsible have not been held responsible. They haven't reassured the people. They haven't put monies for public education and public awareness. The vaccines are expiring. They haven't even reached near their own projections, their own numbers. This is December 2021. Where were they supposed to be and how far are they? The questions you asked. Why is the land border closed and the airport opened? So what exactly is this policy? The public health center is not an event. It's not a public address. It's a process. It is a process to ensure proper public health, to ensure that everybody is safe, every Ghanaian is safe in Ghana. It's a process. You can't skip steps in between and jump to the end and now put the responsibility on the individuals when you, as the government that have been paid to do the work, haven't done the job. You cannot. It can't happen. So now they're going to cause a lot of confusion at the airport. I just traveled and came back a couple of days ago. Go and see what is happening in the airport. The backup, waiting for your result. There's not even enough staff there. Just for the result that you pay from Abuchi before you come. They can't find it on the system that we put it in before we traveled. You get here and you have to wait with your luggage. Everybody is waiting, causing a complete backup. And now even this COVID thing that we shouldn't be in groups is now happening there. One person can access the system to make changes. Another person can access it. Basta. That is what is happening at the airport today. Not to mention the company made $90 million last year and they only gave the country $1 million. They are using Ghana Health Service staff. They are all wearing Ghana Health Service uniforms. They are using some of the Neguchi staff. Yet they give the country $1 million. And you take 18 million with whatever amount they took. Where is that money? And why can't they have more staff at the airport so that the system doesn't back up? And now you can't even implement simple things. They are taking our money. They are using Ghana facility. The airport is our facility. The staff is Ghana Health Service staff. They are using Neguchi staff. How much of that money went to Neguchi and how much went to Ghana Health Service and how much came into the country's coffers? And now you are going to create another whole vaccination thing, which you yourself can't even implement the simple ABCs of the thing. Now you are going to go to D and E. Tanya, it's not a talk. It's not an address. I've even stopped listening to these addresses. Because the issue is, what is the policy? We want a comprehensive policy and we want follow through and we want the government to reassure the public that the vaccine stock is safe. Some of us have been talking. We've been talking that the vaccine is safe, but they themselves go around and sabotage us. And then they turn around and put the onus on the people. We say fix the country, you say fix yourself. How do we fix ourselves if the people in charge of our health system can't protect us? They are the ones we are paying. Our health minister, as we speak today, is still at post. No accountability.
Well,
no explanation, no reassuring the public. So you are eroding the public's confidence in the system.
And Doc,
you can't turn around and mandate somebody to go and take a vaccination. If they had done everything, the processes were in place, they had gotten competent people to do the policies and to put the systems in place, this mandatory vaccine thing will not even be a problem.
Is that why you use the word as strong as
strongly believe that everybody should be vaccinated?
Doc, can you hear me?
But knowing the system and how they have botched it, How do you even tell people to go and get vaccinated? They are saying that the vaccine is going to make me vote for someone else. They started with this thing political from day one. It was about protecting certain people. Today we are where we are because the message they sent have gotten to the people that this thing is political. How do you get out of it?
Hello, Doc. Can you hear me? Doc, can you hear me?
I can hear you.
Okay. For a moment there, I thought you could not hear me anymore because I was coming to draw attention to the fact that the word you are using to describe the manner in which they've acted in dealing with the COVID-19 issue is schizophrenia. And I'm just reading from the American Psychiatric Association. And they said symptoms include delusion, hallucination, disorganized speech, trouble with thinking, and lack of motivation. But that is not what you get when you read the statement of the Ghana Health Service. They are clear in their mind as to why they are doing this. They are saying that if you go back, in November 2020 alone, 168 cases were detected compared to 241 cases in November 2021, an increase of over 40%. So they are trying to deal with that issue at the airport of then seeing a lot more cases.
Sena, I think I've laid everything out. I agree that when the cases are going up, we should step up. But how do you go back when you have already contaminated the system? How do you go back? You can't. You haven't done the proper implementation. The people in charge have not reassured the public that this thing is safe. You go to the airport today and it's complete chaos and confusion. There's a long line. Everybody is waiting. There's 3 people, only 2 people I saw at the desk. Everybody is waiting. If 3 flights arrive today, the whole place is in chaos and confusion at the same time. So how are they? The president has said it. Like I said, it is not an event. It is a process. They have to go through the process. And the process means that you dot your I's and cross your T's from the beginning. So now you have seen more Omicron and now you're going to vaccinate people at the airport when you can't even do a simple test at the airport and finish it.
No, but is what is being proposed different from what is being done in other jurisdictions? Are we a unique case?
We are a unique case because in other jurisdictions, the health officials are in charge of COVID issues. Public health officials and proper medical people are in charge. In this jurisdiction, they have made COVID politics. That's the difference between us and them. In other jurisdictions, when they do come up with a directive or the president comes up with a directive, they do follow through. They don't leave the directive halfway. In other jurisdictions, the health minister did not go and buy questionable vaccines and bring it into the system to contaminate the system. And in other jurisdictions, if the health minister had done that, he would have stood up and reassured the public and been accountable for that mistake. In other jurisdictions, we have people who are competent to manage the system, the COVID issues. That is the difference between us and other jurisdictions. So we don't go and copy by mistake just because someone else is doing it. Well, you haven't done it. That is the difference between us and other jurisdictions. So, Sena, let's be practical and let's look at our issues as we stand. In other jurisdictions, they are even having issues where they have done aggressive public education, where 600,000 people have died in over 600,000 in the United States. They are even having vaccine hesitancy issues. In other jurisdictions, they did everything, but they are still having people, anti-vaxxers. They are having vaccine hesitancy issues. So in your jurisdiction that you haven't even done your public health, what do you think will happen? In your jurisdiction that you have done in politics, don't you think people would say, like they said in the Volta region, I just heard, that if they take the COVID vaccine, they are going to vote for NPP? You understand? So the issues should be devoid of politics. Our health is not a respecter of NDC, MPP party politics. That is the situation we are in today. And that is why the policies, this thing is not going to work. Because who will force people in the airport to get vaccinated?
But so far they tell us it is working. But of course, you are coming into Ghana, and if you come into Ghana and the authorities are telling you have to be vaccinated compulsorily, or you don't stay in Ghana, you have only one choice to make: either you take it or you go back.
So, for instance, if the person doesn't want to take it, right, and they don't have money to get back on the flight, what will you do to that person? I mean, you have to think through. I'm just giving you a hypothetical situation, but it can happen. What will you do? Will you arrest them? Will you take them to jail? Or you take them to hospital? Or you take them to hotel and force them to pay? Is that false imprisonment? Because the person doesn't have the financial thing. Second of all, you can't force the airline to send the person back. Because according to the airline, they tested negative from where they came from before they got here. Every airline these days, if you don't have a negative COVID test within the 24 to 48 hours before, they won't take you on the flight. So the airline has done its part. So you cannot hold the airline responsible. I heard somebody saying we will charge the airline 3,000. Airline, what have they done? They haven't done anything. They did everything right. They made sure that before I traveled last week, I got my negative COVID test.
But not if the policy has changed that if somebody is not vaccinated, the person should not come to Ghana. Because it seems as the new policy.
What if somebody has an emergency in Ghana and they have to come, but they haven't been vaccinated? They tested negative in wherever they are coming from. They got all the documentation for the airline. They sat in the plane and they got here. And the person said, me, I have some medical problem, so I can't take vaccine. Or I don't have a medical problem, but I don't trust your vaccine, so I won't take it. What will you do? You understand? So I think that instead of making it mandatory, I think that we should continue, put more money, put more resources into educating the public awareness, public education. We can continue to inform the public to wear nose mask everywhere you go. Go back to the social distancing issues. When you are in a room and there's too many people and you feel like the air, there's not proper ventilation, leave. If somebody is coughing next to you, move. We need to continue to educate the public. You can't sit on that information and then come up with policies that you yourself can't even implement. The last one you did, you haven't implemented it. Why is the airport opened and the land border closed?
Maybe then I should read to you what the president said yesterday. And this is what he says. As you know, the decision to close our borders, which are a source of livelihood for many, was necessary because we wanted to limit the importation of the virus into the country. We are monitoring the level of threat of the disease and ongoing vaccination in our neighboring countries. And as soon as we are satisfied that it is safe to do so, the borders will be open. So they are talking about the same vaccination issue when it comes to our border countries, how well they are doing, before they make that decision.
So why can't they do the same thing they're doing at the airport at the border? I'm confused.
That is vaccinate people who are coming in who are not who are unvaccinated. Do the same things at the borders.
Yes. Not this. What I'm saying is, why don't you, whatever policy you have today at the airport, why not implement that same policy, which is everybody gets there and you get the COVID test before you come into the country? Why is the land border different from the airport? I'm confused because they are all entry points into the country. The difference is one has money to buy a $3,000 or $1,500 dollar ticket, and one at the border doesn't. It's coming by car. What is the difference besides the mode of transportation? Entry point is entry point. The mode of transportation should be irrelevant to the fight of COVID. As a matter of fact, Europe has more COVID cases than Ivory Coast. Europe has more cases than Togo. America, over 600,000 people have died, more than Togo, Ivory Coast, Burkina, all those places. The borders combined. So if somebody is more likely, by statistics, to come through with a positive COVID, then it's coming to the airport. So why are the land borders closed? See, it has to be uniform. It has to be consistent. It is not an event. It is a process. And the process has cut across board. So everybody is aware. What is our policy? We are coming to Ghana from land, from air, from sea. This is the policy, period. They are all entry points. Don't pick and choose and make the thing schizophrenic. Like I said, delusions, whatever. Speak something, say one thing here, say another thing here. Health minister go and call some Arabs to bring some drugs that you yourself didn't even verify. They didn't even bring the medicine. The ones they brought, are they still in the system or did you remove it? You can't. That is the schizophrenia that I'm talking about. For us, some of us health officials, public health people, it's very confusing.
So there's a lot of policy inconsistency you're seeing here, but the accountability part, why is it so important? Because you keep saying the health minister has brought in certain vaccines to contaminate the system. What do you mean when you say that?
I'm saying that because remember that several months ago, we had a whole issue about some Arabs who were supposed to bring us some Sputnik vaccines that were supposed to be more, that the thing was selling at $10, and they sold it to us at $19. That's twice as much. Then they brought some samples that were mismatched, and the samples came into the country. Then we weren't even sure the source of that Sputnik vaccine, that the health minister went to parliament, and we had this whole conversation. Up to today, has the health minister come to assure? That is when he started eroding the public confidence in the vaccines in the country. All the work that we had done prior to that one incident, that one thing that the health minister did, eroded, maybe took us back how many months from the COVID fight. Up to today, he hasn't even apologized to the country. He hasn't come to explain to us what happened. He hasn't reassured the people that the vaccines are good. When we were saying the vaccines are good, even when he was misbehaving, we were talking about that this thing is good. But it erodes public confidence. See, the people you put in charge should be held to a different standard, a higher standard. Up to today, he hasn't done it. So now, are you surprised that somebody thinks that COVID has something to do with politics? No, you're not. I am not. Because I understand human behavior. Are you surprised? I'm not. The man is still at post. He hasn't explained to us. He didn't tell us if those vaccines that the Arabs came into the system or didn't come into the system. He didn't tell us what he did with it. He didn't apologize. He didn't even reassure the public. But listen, it was a mistake that I did. But let me reassure you, as the minister in charge of your national health equals national security. Let me reassure you that the vaccines in the country are safe. The Sputnik vaccines that this issue came about, they have been removed out of the system. So rest assured that I will ensure that the vaccines are proper. They are whatever he has to say to the public, to reassure the public, to instill public confidence in these vaccines. He didn't do that. So now how do you turn around and expect everyone to believe that your vaccines are good?
Doc,
you can't eat your cake and have it.
Doc, thank you very much for speaking to us this morning. And I'm grateful.
Thank you very much, Zena, and Merry Christmas to all our listeners. And a happy holidays. And let's all stay safe. The COVID is real. The Omicron is real. Those of us who can get vaccinated, please get vaccinated. That is the only way we can get out of this. The issue is when you get vaccinated, the chances of you getting COVID might not change, but the chances of you getting sick and dying from COVID will change. So even with the Omicron, if you are vaccinated, you are less likely to get to the hospital and die from COVID. So those of us who can, please get vaccinated, continue to wear your mask, continue to ensure social distancing, and continue to protect ourselves. God bless us all and have a Merry Christmas and a happy